Hey everyone, welcome to my channel, welcome to my first video. I hope you're all doing well. I wanted to make a video and talk about a surgery that I had on my knee 3 weeks ago. So it was ACL reconstruction, and along with this I had my lateral meniscus partly removed. So I torn that and had the torn piece removed. So I wanted to talk about how the first 3 weeks have gone, and going forward I'm going to try and document my journey of how I'm getting on and my return to sport, which will probably be in around 9 months time. So all being well, that is the plan. So if you have an ACL surgery and are interested, stick around and hopefully this helps you. Or if you're just generally interested in what it's like to have this surgery, I hope you also stick around. But this video is going to be probably about 10-15 minutes long, and a lot of it's going to be me talking. If you enjoy it, stick around, and hopefully it's interesting to you. So like I said, I had my surgery 3 weeks ago and I went abroad for this surgery. I went to Lithuania, and I'm going to talk more about why I did this in my next video. So I'll break down why I went abroad, how much it all cost me, and how I went about finding this clinic, and yeah, how I sorted everything basically. So that'll be in my next video. But in this one, I'm just going to talk about what I've been doing the last 3 weeks and the surgery itself. So let's get into it.
Suitable patient for ACL repair is the patient with diagnosed ACL rupture and with instability of the knee joint. To diagnose ACL tear, we perform MRI, X-rays, or sometimes ultrasound. Arthroscopic ACL reconstruction starts with harvesting of tendons. Tendons are used to create a new ligament. After that, through small incisions, we insert our camera inside the joint. We can inspect and prepare for ACL reconstructions. During arthroscopy, we drill tunnels through the bones to pass a new ligament. New ligament is fixed on the bone with special implants like screws or endobotomy.
I was under anaesthesia, spinal anaesthesia, so I was basically asleep for the surgery, which was obviously good. And like I said, it lasted around 90 minutes. As soon as the surgery had finished, I woke up, and I just remember them moving me off the surgery bed onto my bed. Yeah, it was all a bit weird, and I remember the surgeon talking to me, telling me how things went. And from then I was numb. I was numb from the waist down, which is a mad experience. Just not being able to feel anything. So God knows if I needed the toilet or something. But yeah, other than that, yeah, the surgery went well, and following that, I spent the first night in hospital, and then I left around midday the next day to my hotel. And for the first couple nights and days, I was in a lot of pain, didn't get any sleep at all, and even now I still don't get a good night's sleep. It's not because of pain; it's just for comfort. Yeah, it's so hard to get in a comfortable position and not put my knee under stress. So I'm trying to keep my leg as straight as I can while I'm sleeping, but I'm not someone who can sleep on my back, so I'm having to sleep on my side, pillow in between my legs. And yeah, so sleeping's been probably the roughest part of the last 3 weeks. Like, I've not had a good night's sleep. I'm waking up 5 or 6 times throughout the night, so hopefully it won't be too much longer like this, and yeah, I'll get a good night's sleep soon, hopefully. But other than that, I was given a lot of medication, and that's obviously helped with the pain. I'm sort of not taking any more now. Taking ibuprofen a little bit to help with the swelling and the inflammation. But yeah, I stopped taking like the painkillers, the strong painkillers, around a week ago. So 2 weeks after surgery. Yeah, I just thought the sooner I get off them, the better. And I'm not in a lot of pain now. It's just certain things I've been given exercise from my physio, and obviously I'm restricted to what I can do, certain movements and stuff. But other than that, within the first 2 weeks, I still had my stitches in, and I was changing the dressing every day, or sometimes twice a day, just because the dressing I had was pretty crap. It wasn't really sticking. I thought they'd shave my knee at least, so it'd help, but obviously I'm putting this dressing on my knee and it's not sticking, so I'm changing that once or twice a day. Obviously, when I'm washing or showering, I'm not allowed to get it wet. Obviously, up until I got my stitches removed, trying to have a proper wash was really hard. Climbing in and out of the bath when I couldn't bend my leg was really tough. So yeah, that's how the first 2 weeks was with that. I was obviously washing once a day, but it was tough. And yeah, I had to wash every day because I don't know if it was the medication that I was on or just because I've had surgery and it's the way my body's reacting, but every night I was sweating during my sleep. So when I was sleeping, I was sweating a lot, and I think that's quite normal for surgery. Probably doesn't sound too pleasant, but yeah, there's a lot of sweaty nights after surgery. Other than that, my leg was sore and it had swelled up a lot, more so when I got home. So I had the surgery on the Monday the 10th. I flew home on Friday the 14th, and my leg had swelled up around 3 to 3.5 inches from my ankle up until my quad. Yeah, 3.5 inches ish in thickness all the way down, and my whole leg had turned purple, so you'll see that here. Doesn't look too nice, but how I managed to get that back was I iced it every day, 3 times a day, and I was obviously taking medication and elevating my leg a lot. So elevating it from the heel, not the knee, because you don't want to be bending the knee. It was more I was really working on getting full extension, so getting the leg straight. So elevating it from the heel 2 to 3 times a day. But in general, I would always have something under my heel, like just a light, like a thin pillow, just so it was slightly more elevated than the other leg. But yeah, I think the reason my leg had obviously gone purple, obviously they'd taken a piece in my hamstring. There's obviously a lot of blood, and it's ran down my leg, which is quite yeah, it's normal. I was obviously worried at the time, but I've read it, like done a lot of research and stuff just to make sure it's nothing to be worried about. So that's sort of what to expect within the first 2 weeks. So after 14 days, I had my stitches removed, so last Monday. And with me having my surgery abroad, I wasn't sure how I'd get this done, but I just phoned my GP. Had them done last Monday, so had them out, and that felt for me like the first sort of step of my recovery. So stitches out, and already like the knee was just looking a lot tidier, a lot healthier, and in general the scarring looks really good. From then, I was trying to gain a little bit more flexion in my knee, so just a little bit of exercise, a little bit of bending the knee, but I hadn't seen my physio yet, so I didn't want to do too much, and I thought I'd rather just wait until I see the physio. I seen the physio last Wednesday, so this would be 16 days after surgery, and pretty much told me that the surgeon has done a great job, which for me, very good to hear. Obviously, going abroad for the surgery was scary, but I don't regret it, and I'm glad I did it. So for the physio to tell me that he thinks the surgeon had done a great job was like very reassuring. So yeah, like I said, I'll talk about that more in the next video. But yeah, physio very happy, and we just discussed what the plan is, how I'm going to move forward, and what sort of I'm able to do now. So obviously I've got a lot of extension in my knee, my leg's looking straight, but I also need to work on the flexion, which is bending my knee, like I said. So giving a couple of exercises, like hanging my knee over a bed, or something, just hanging my knee over it and trying to bring my heel as close to my bum as I can. He thinks I've got around 80 degrees of flexion already, which is really good within a couple of weeks, and I've just got to try and make that better. Another one is something under my knee and trying to engage my like sort of patella, so squeezing from the knee, trying to engage my quad, my quadricep like muscles, like forcing something under my knee into my bed or something, just pushing down and trying to work on getting like the muscles and stuff working. So that feels quite good to do. I quite like doing that one. But other than that, there's only a couple of things he gave me to do. I'm seeing him again on Thursday, so we'll see how I'm getting on. And I reckon I'll probably be given a couple more things to do. But I'll talk about this more in the next video. So what I'll do is film a lot more of this, and yeah, you'll be able to see some more of the exercise that I'm doing. It won't be as much talking, it'll be more exercising, so I hope that is a bit more fun for anyone watching. But yeah, that's how the first 2 weeks went. That's sort of what to expect. So rough sleeps, a lot of pain, swelling, bruising, but it's all normal. Yeah, just resting. So like I said, iced it a lot, elevated, and yeah, that's all I could do. So that's how the first 2 to 3 weeks had gone. I'm still on my crutches. Sorry, I didn't mention this. I'm on crutches, obviously. My surgeons advised crutches 3 to 4 weeks. 3 weeks, I still need my crutches. I feel I'm not weight bearing it. I'm still a partial weight bearing, so a little bit of weight on the foot. I'm still in my knee brace. Yeah, I'll show you my knee brace. It's quite good. So yeah, that's all there is to it. But I hope in the next video I'm going to be up and about walking without my crutches. I'm excited for that. As soon as I can get rid of my crutches, things are going to be a lot easier for me. So yeah, I hope this wasn't too boring, and check out my next video. Like I said, it's going to be the one where I'm talking about going abroad, so why I went abroad. So thank you for watching, and see you later.